So homelessness, let's talk about homelessness. 1 in every 194 Americans experience homelessness. That's a staggering number. But not all homelessness is the same. Not every homeless person requires the same response, intervention, or sort of cost to the system. But there is a percentage of our homeless population that is known as chronically homeless. And for those of you who that's clear what that definition means, it means that somebody has been homeless for a period of time and has a disabling condition. In Santa Clara County, we have the 3rd highest chronic homeless population in America. That's a staggering number if you think we're behind Los Angeles and New York City, and then Santa Clara County has the 3rd highest chronically homeless population in our country. We combine that reality with a really tough external local landscape. We have also probably the highest rental market in America. If not the top, we're in the top 3. And we have one of the smallest vacancy rates. So now we have extreme poverty. We have a lot of folks coming to the valley to live and work. We have a shortage of housing, a very extreme shortage of affordable housing, and a vacancy rate that is extremely tight. So historically, our response is not different than most of America, has been when you're facing chronically homeless folks, the folks that sleep under our bridges, the vets who've been outside since Vietnam, the folks that we often step around, right, on the corner with their shopping carts. We think, whoa, there's nothing much we can do here. The best we can do, maybe, is a meal, a night in a shelter, a blanket, some form of compassion, because that's the best we can do, because they must want to be outside. And that was the thinking for decades. And then in the year 2000, a new philosophy came about, which is called housing first. This was started through the Bush administration under Philip Mangano, the Interagency Council on Homelessness director. And it was a concept that was really pioneered at Pathways to Housing in New York City that was pretty simple, which was the end to homelessness is a house. And it doesn't really matter who the person is, because the house is what the intervention is. The house is the treatment option for people who don't have it. And they started taking people that have been homeless for years and decades, were severely mentally ill, and did a lot of drugs, and put them into their own places. And person by person wrapped those people with supportive services, and over time started to realize that 85% of the time, these folks stayed housed. It's amazing. And for a cohort of that population, the service utilization before they were housed was so extreme, and the service decrease was so extreme once they were housed, that actually saved money. So if you have a person who used the emergency room 200 times last year, and in between got arrested a few times and rode in the ambulance on the way there, and then stopped at every shelter along the way, that's a lot of money, often 2 to 3 times more than the cost it is to subsidize a house. So that's when Housing First was born. And over the last decade, it has grown, it has been adopted by our federal government, it has been now seen as the primary intervention for ending chronic homelessness. But we're still left here with our external reality. Highest rental market in America, smallest vacancy rate. So we can love Housing First, but it makes it even harder to do here. So a couple of years ago, a group of us got together, many of you are in this room, and we said, we can do better than we've been doing. We can take this Housing First model, we can create the national energy around this model and localize it here in our community, work with all of our extraordinarily talented nonprofit partners to house the people that have been outside the longest, and see how long and how well they can stay housed. So we started this about 2 years ago with this very small handful of housing units and 2 or 3 service providers. And today, this is called the Housing 1,000 Project. We have 12 or 13 service providers. We've housed hundreds of people. And along the way, we decided in order to be able to say how effective this was, we needed to be able to make sure that we were measuring the results. So that's when we were able to partner with the County of Santa Clara and say, what would it look like if we were able to actually measure all the costs? What if we were able to say, how much does it cost to not house someone? How much does it cost to house someone? And at first the thinking was this is pretty impossible because all of these data systems don't work together, none of them connect. But Supervisor Wasserman, Gary Graves, others said, well, we think we can get this done. And so let's find out what it takes. And so we brought a firm from LA, Economic Roundtable, who's one of very few firms that are doing this kind of work in our country. And long story short, we've been able to link every database that has to do with people touching homelessness in and outside of the county, and are in the middle right now of analyzing those costs. And we'll have a first of its kind cost study that will be supportive of the permanent supportive housing strategy and the work that we're doing through Housing 1000. And the early results for this are really promising. The utilization is high. Once folks are housed, the utilization comes down. As Gary had mentioned, we'll have those results coming in the spring. But really that was the foundation for this project, and something when we knew if we were going to build a project that was going to take all of our nonprofits working together to house what has been historically the really hardest, most difficult, challenging folks in our valley to house. And these nonprofit providers are doing that work every single day. And somehow, I think they're miracles, because they will get the guy with the shopping cart who's been outside for 20 years, and somehow the landlord with the one unit that everybody wants, they'll still rent to them. And I don't know how they do it, but it's pretty heroic. And so what this means, though, is this is an opportunity to scale. We're going to have the data from the cost study to be able to look at how much it costs pre and post housing for specific people. And we'll be able to apply this intervention that is not perfect yet, but that we have a strong cohort of people that are working on this issue, and hopefully using this opportunity to create more scale, which means more housing units, which is the thing that is desperately needed in our community, to put this together to create a model that we think fits really, really well with Pay for Success. So we could not be more thrilled to be here and be part of this project, and are so thankful to our county leadership, to the Health Trust, to the community foundations, the Sobrado Foundation, Catholic Charities. Step up. Thank you so much.